Hello, welcome to my channel. Today we will talk about predictive analytics in healthcare. I always aim to simplify complex information, so stick with me as we break this down. First, imagine a healthcare system where we can predict illnesses before they occur, personalize treatments for every patient, and even reduce hospital readmissions, all by using data. This is the promise of predictive analytics in healthcare. But what is predictive analytics? Let's start with the basics. So what is predictive analytics? Predictive analytics is a process of using historical and current data to forecast future outcomes. Think of it like weather forecasting, but instead of predicting rain, we predict health events like disease risks, treatment outcomes, or patient deterioration. It's all about patterns. By finding patterns in the data, we can make informed predictions that help doctors, nurses, and administrators make better decisions. Next, let's take a closer look at the key data sources that fuel predictive analytics in healthcare. First, we have electronic health records, EHRs. These are like digital treasure chests, holding information from patient visits, lab results, and medical histories. All of this data helps build a comprehensive picture of each patient's health. Next, there are wearable devices. Think of smartwatches and fitness trackers. These devices collect real-time information, like heart rate, sleep patterns, and activity levels, providing valuable insights into a patient's daily life. Finally, we have social determinants of health, factors like income, education, and access to healthcare. These give us the bigger picture of how a patient's environment affects their well-being. By combining data from these sources, predictive analytics creates a powerful toolkit for improving patient care and outcomes. Let's see how it all works. Now you might be thinking how predictive analytics works. Let's break it down into 3 key steps. 1. Data collection. The first step is gathering data. In healthcare, this could be anything from a patient's blood pressure readings to their medication history. 2. Data analysis. Next, the data is analyzed using advanced statistical methods and machine learning algorithms. This is where the magic happens. These tools identify patterns that humans might miss. 3. Prediction. Finally, these patterns are used to make predictions. For example, the system might predict that a patient with certain symptoms has a high likelihood of developing heart disease in the next 5 years. Now, let's talk about machine learning, a key component of predictive analytics. Machine learning is a type of artificial intelligence where computers learn from data instead of being explicitly programmed. Think of it as a computer teaching itself by analyzing examples. For instance, if a machine learning model is given data on thousands of patients with diabetes, it can learn to recognize what patterns, like blood sugar levels or age, are associated with complications. Over time, it becomes better at making predictions for new patients. Now I will give you a few examples of predictive analytics in healthcare for better understanding. So first, let's imagine a busy hospital emergency room. The clock is ticking, the waiting room is full, and staff are juggling patient care while trying to manage limited resources. Now picture this. The hospital uses predictive analytics to forecast patient volumes based on past data. By analyzing patterns, the system predicts that today we'll see an unusually high number of cases by mid-afternoon. Armed with this insight, the staff can prepare in advance, bringing in additional resources, assigning beds more efficiently, and ultimately reducing patient wait times. This is how predictive analytics turns chaos into control. Now, let's step into the story of Maria, a heart failure patient who has just been discharged from the hospital. Without intervention, Maria has a high risk of being readmitted due to challenges with medication adherence. But the hospital uses predictive models to identify patients like Maria. The system flags her, and doctors intervene with tailored support, setting up reminders, arranging follow-ups, and offering personalized care. Because of this proactive approach, Maria stays on track, avoids complications, and doesn't return to the hospital unnecessarily. These are real-life examples of how predictive analytics transforms healthcare, helping hospitals stay ahead and ensuring patients like Maria get the care they need before it's too late. Of course, predictive analytics isn't without its challenges. Let's talk about top 3 challenges of predictive analytics. Data privacy, because protecting sensitive patient data is critical. Accuracy. Yes, models must be carefully tested to avoid false predictions. Cost. Implementing these systems can be expensive, especially for smaller hospitals. But the future is bright. As technology advances, predictive analytics will become more accurate, affordable, and widespread. Imagine a healthcare system where diseases are detected before symptoms appear, treatments are personalized, and patients spend less time in hospitals. Predictive analytics is turning this vision into reality. So, predictive analytics isn't just about technology, it's about improving lives. By combining data, machine learning, and human expertise, we're creating a smarter, healthier future. The question is, are we ready to embrace it? Tell me in the comments below. I hope you like my video. Please subscribe to the channel for more videos and comment below for any question.